the last presenter is George Fernaine. Go ahead, George. Are you ready?
I'm ready. Do you see my screen and can you hear me?
I can hear you and I can see your screen.
Great. So first of all, I want to thank everybody at Innovator MD for inviting me. My name is George Fernaine. I'm a practicing interventional cardiologist in New York, and I am here to share what Mocingbird does as a platform. So the tagline is, you take care of patients and we take care of you. Oh. So we're trying to change a process that is tedious yet vital to all healthcare clinicians, doctors, nurses, PAs, NPs. Telehealth is on the rise. Clinicians are obtaining more licenses to keep up with patient demands, while CME rules and regulations are changing constantly. Our mission is to improve medicine and clinician well-being by eliminating the chaos of ongoing credentialing and delivering high-impact continuing medical education that promotes lifelong learning. Many people talk about the triple aim being improved patient experience, better outcomes, and lower costs. At Mocingbird, we believe in the quadruple aim, and that fourth aim is improved clinician experience. If you can improve the experience and the lifestyle of your physician, your nurse, your PA, your NP, then you're not going to be able to improve patient experience, get better outcomes, and learn how to do things at lower costs. So what are the challenges? Challenge number one, we have multiple requirements, multiple state licenses, multiple board certifications, hospital requirements, expirables, ACLS, BCLS, infectious disease, opioid training. They're all asynchronous timelines, multiple different kinds of renewal dates, sometimes yearly, sometimes every 2 years, every 5 years, every 10 years, on your birthday, in October, sometimes December, is it the 31st or the 1st? And there's tons of documentation. Where do I keep it? Thumb drive, desktop, Google, in a back of my desk on a folder, behind a book, somewhere, in an email. And there's a lack of control and analytics. There's no reminders, there's no overview, there's no way of knowing what needs to be done, and the stakes are high. The stakes are basically, are you certified to practice your field and your profession? So how does it work? It's a platform for clinicians and administrators that automates the process of managing medical licenses and certifications. So for the clinicians, nurses, PAs, NPs, doctors, we offer a personalized dashboard, all your licenses and certifications, the corresponding rules and regulations, the timeline, and access to anything that you need to meet those requirements. For the administrator, bird's eye view across the whole organization, reporting tools, eliminate financial risk of a clinician practicing with a lapsed or inaccurate license, especially when JACO or the Department of Health jumps in. So here's a case study. This is me without Mocingbird and without a goatee. I have a license in New York, New Jersey, Connecticut. I have certifications in ACLS, DEA. I have 4 boards, internal medicine, cardiology, interventional. I need to research the requirements for all of them because they change. I need to understand the complex regulations. I need to review my status. I need spreadsheets and papers to keep everything that I've looked at and all the education that I've done. And then I need to find the courses. I need to look through it, web-based, some of my societies, are they ones that I need? Do they apply to this certification versus another? If I did I do it in a timely fashion? Is it 2 years old and expired, or is it within the time frame that I need? If you add Mocingbird and just learning the CME, I can save 50% of my time. 50% of my time to do whatever that needs to be done. Spend time with my family. Take care of patients. Do something that's helpful for me. So, what does the map look like? We are not a credentialing company. We take over after the credentialing, after you've applied to your hospital credentials and after you've gotten your boards, after you've gotten your license, you will come to us, you will place all of that into our system, and we will monitor all the rules and regulations, all the requirements that you need, and point you to the directions of where you need to learn and get done in order to maintain your licenses and certificates. And then when recredentialing comes, you will be able to recredential without a problem because everything is at one site and at your fingertips. It meets you wherever you are. You're on the desktop or you can be on the app on your phone. I have actually done CME on my phone while watching my kids take a ski lesson. What we do, be in control of your CME, streamlines everything. We keep a track of all your state and board licenses, and then we adjust all the rules and regulations as they change. And we send you automatic reminders. And then we also provide an area for quality, curated medical education. This is the education that you want based on your profession, based on your interests. There's a dashboard that makes it very easy to see everything either on your phone or desktop. There are simplified task lists. There's an administrative dashboard so that providers can show in real time what is happening across your organization or your department. Are the physicians, nurses keeping up with their licenses? Do they need a reminder? And then if the DOH or Department of Health comes in and they ask, it's easily attainable based on the dashboard. And you get automatic notification. We are trying to streamline it so you never have to do anything other than to look at this dashboard. And at the end, there's a CME marketplace where we're curating high quality continuous medical education content. We don't create the content, we partner up with it, we put it on our site, and there's no wasting of time in trying to find something. You can search for it, and then whatever CME you have done will automatically be part of our system. We have multiple customers and partners, and here are a few of them. They're leading healthcare organizations and they trust Mocingbird. Why do they trust us? Because we give them opportunity. For the executives, we promote clinician engagement. We do on-demand real-time reporting and compliance risk. We ensure high-quality professional education. We improve patient care because they are learning what they need to learn. For the clinicians, it's all automated. You don't need to look for the rules. We update and validate the requirements, and we provide you the education you want. And for the medical staff team, they're able to be in control, retrieve, store, and generate whatever reports that they need. This is our team. It's a great team. They're very excited. They are committed in providing a way to make healthcare clinicians, nurses, and PAs have a better life. And by doing that, we can help our patients. These are our leaders. I co-founded this company with Ian Madam. He is a practicing spinal surgeon. We both love taking care of patients. We love it, but we all have the same problem, all our colleagues. So we have hired a team led by Brad Artery, who's our CEO. This team is committed 24/7 in getting this product out there. And we provide them with the strategy and the product advice in order for this product to be truly brought to the attention of the first line user. That is our goal. We are not looking at making the administrator happy. We're not looking at making an enterprise happy. This is first line clinical use. And because the clinicians are going to be using it, it will fall back on the administrators and they will be able to get all their data that they need. Here are some of the leading experts that are with us. Not all of them are in healthcare. A lot of them are in different areas, all of them bringing in their networks. And the one common thing that they all have is they all have loved ones that are in the healthcare field, and they're all taken care of by healthcare providers. So it is in their best interest to make this product work. Our ask is simple. You know, we want to expand our network. We want to get strategic partners in healthcare organization and telehealth companies. We want to use a network to get potential investor introductions. We want you to help us take care of the people who are going to take care of you and your families for the next several generations. I'm happy to answer any questions.
I think all of us in medicine have dreamt of your service line. If it works as good as you market it, that's very exciting. It seems to me that one of the companies you should probably talk to is United Health. They now have 59,000 doctors working for them, and they deal with multi-state licensing on a daily basis. You started talking to Optum.
You broke up there for a second. I heard United Health.
Have you started talking to Optum, because they have this problem, or rather the use case is very clear to them?
I don't believe we have started talking to Optum, but if you have connections to Optum or United Health, I would be happy to meet with them. But thank you.
Let me learn more about you first before I start introducing you.
You mean those 10 minutes or 8 minutes weren't enough?
You tell me. Anyway.
Okay, any other questions, judges?
Yes, I have two quick questions. One of them is just confirmation. It seems that your customer is really the healthcare organization that employs doctors, not the doctors itself, right?
So we're B2B, but we do have some B2C customers. So we do have availability for B2C, but we feel that, you know, financially B2B would be the better choice.
And the second question, and this will be probably like trivial for most of the people in the audience, but I'm not a doctor. I attended the session that was explaining the different recertifications and certificates that doctors need to keep up. But can you help me understand how big of a problem it is for a doctor to keep up, to keep being recertified? Like, is it really like super hard because you are busy, or because you have like so many options and you are trying to just get over it in a way that helps you educate? Like, I'm trying to see like how big or pressing is the problem you are solving.
It is an astronomically huge problem. The amount of regulations and time required to maintain everything that we need to maintain takes hours and hours. It's a big problem. I don't know, you know, hundreds of hours are spent every year by me trying to get this all done and make sure I'm up to date. And even then, I sometimes miss things through the crack because there's nobody that's reminding me or telling me of the changes that are occurring within the regulations. So it is a very big problem. Just ask your physician the next time you talk to them.
Yeah, when I talk to my physicians, they are so busy that I'm trying to like be careful like what I'm using my minutes for. But yeah, so it seems that it's keeping track not only like of doctors being current with their certifications, but also directing them what the options are and what the regulations are. So
right, and
so it's like
them,
personal assistant, right? Almost.
In some ways, it's also directing them to the right materials. You know, it's hard to find the education that is good for you and that you need to learn in order to help your patients, right? If I'm a cardiologist, I don't really want to learn about dermatology, but you know, I'm looking through a list of different courses and dermatology is the only one that's available. And then I have to go to a different website, right? So those kind of things become very frustrating and I lose a lot of time for that. If I get the right education at the right time, that saves me time. And then that's stuff that I can help my patients with because I'm learning what I need to learn.
So basically this platform aggregates and consolidates the regulations and the educational options, right. Correct? Okay, thank you.
Quick question, George. What is your, obviously you have two businesses here, right? One is certification management and the other is CME curation. Your certification management is the one that has less competition because I don't really know anybody who does that well. CME management, obviously you have a lot of competitors. One platform, theoretically, there's some synergy. In terms of your certification management, how much are you charging a single subscription fee for one, both services? How are you doing that? What's your revenue model for that?
So right now we're doing a subscription fee per clinician. And then there are different grades based on how much utilization you want. So if you want the CME package, it could be a little extra. And there's sort of like bells and whistles within that, the dashboards and the reporting system where you can add to it.
Can you give me a ballpark on what you're charging right now, or is that a trade secret?
No, it's not a trade secret. I think it's around $350 per clinician. You know, you can make it work. We're not, you know, if it's a smaller, you know, practice, you know, we're not going to be too difficult with that. But it's around $350 per person. A little less for nurses, of course.
You have a question in the chat room: per month or per year?
Oh, per year.
Okay. Any more questions from the judge? I guess not. I'd like to thank the judges, but